There are a number of differences between the way that males and females produce voice, and that's largely down to the anatomy of the larynx and the vocal folds that sit inside the larynx. So in males, the cartilage that forms the prominence, the Adam's apple that we can see in men, is at a much, much tighter angle. So you can see that it's much more prominent in the neck compared to women. The other difference is that in men, because of testosterone that is released during puberty, those vocal folds that sit inside the larynx are a little bit thicker, a little bit longer, and so they vibrate more slowly as the air passes between them, and that creates a deeper pitch in comparison to women. In a typical clinical caseload for somebody who works in a gender clinic, around 80 to 85% of that caseload will be those people who are transitioning from male to female. The reason for that is people who are transitioning from female to male take testosterone as part of their treatment. This immediately causes changes to the vocal folds and changes to the way voice is produced, and usually the voice deepens automatically as a result of taking testosterone. Now, for people who are transitioning to female, the hormone treatment that people take makes no difference to the voice. And so the key aspect there is having voice therapy. And so the hurdles in terms of voice for transgender women tend to be much more significant than for transgender men.
When I was a child, my father was always telling me off for being too girly when I spoke, and apparently I used to move my lips quite a lot. And because I've always been interested in the theatre, and I trained in the theatre, I've always had what I would term a musical voice, and it's always had cadence in it. I think sometimes the problem is that if you transition and you've been used to speaking on a monotone about things and reining everything in, then it gets rather difficult if you suddenly feel that you've got to move your voice about a bit. And it's much nicer for people to listen to if you've got some cadences in there. You rise, you fall, and you've got an expressive voice, and that is the kind of voice I have. And of course, as an actor, that's the kind of voice I need.
I'd only been on, I'd say, the testosterone about 3 weeks, and my voice had started breaking fairly quickly. And so people who were seeing probably once a week actually could notice the difference in my voice. And were saying, crumbs, it's getting deep, it's getting deep. It's still changing now. 3 years. 3 years being on testosterone, but it's still developing. You're going through a second puberty, basically. But when you go through your first puberty, it's over several years. So it's more natural, things develop slower. But when you put on hormones, it's very strong hormone, and the changes happen very, very quickly. So the effects much stronger and more powerful on your vocal cords especially.
When I was at university, I was in a production of The Maids by Jean Genet, who was a French writer, and he was gay, and he always said that any female parts he wrote should be played by the male sex. And I played one of the sisters in it, and I wore a wig, a bob, very much like this hairstyle now, and I looked in the mirror and I completely recognised myself. And so I knew that was a kind of style that I would adopt. And vocally speaking, the person who had that hairstyle was Fenella Fielding, and she had a marvellous, deep, velvety voice, and in fact still does. And I always knew that I would never have a little girly voice, however hard I tried. And I didn't think anyway that it would particularly go with the way that I looked, because I was tall and dramatic looking. And I wanted a dramatic voice to go with it. And certainly when I first started, I had a very dramatic voice, but I've actually learned to soften it and lighten it now, because it can get a bit wearing being dramatic the whole time.
Pre-hormones, obviously, I sounded female, still look female. I was treated as female. And it was very frustrating, especially when you're on the telephone to people. They'd say, can I speak to Mr. So-and-so? Yes, speaking. No, I won't speak. It's a man I won't speak to. Yes, speaking. Oh, right, sorry. So eventually they all right, I can carry on. But you could tell they still weren't sure. But the minute my voice started breaking and changing, which was within just as little as 3 weeks, it started getting lower. Slowly, more and more people when I'm speaking on the phone, started saying he to me and Mr. and saying sir and things like that. And the feeling and lift you got from that was amazing. In fact, and you'd be smiling to yourself.
So there's really three main components that we need to think about in terms of what makes up our voice, and these are pitch, resonance and intonation. So pitch is whether our pitch is high or low, and we can all alter that, but typically a male pitch is lower on average and a female pitch is higher on average. Resonance is about where the voice is placed. It's about the position and the tone of the voice and where the voice comes from. And then the final aspect of voice is intonation. So intonation is the modulations that we have in our voice as it goes up and down, and that's how we express feelings and that's how we express our emotion with our voice. So typically if you asked a man to count from 1 to 5, he would be much more likely to produce 1, 2, 3, 4, 5 in quite a monotone, perhaps quite a flat way in terms of intonation. Typically, again, if you asked a woman to do the same thing, she would be much more likely to put more intonation into her counting. So 1, 2, 3, 4, 5, as opposed to 1, 2, 3, 4, 5. If we were to work on pitch, what we would like to do is to increase the pitch a little. So to help that person sound or be perceived as a little bit more feminine in terms of their voice. So we would start with some humming exercises at that optimum pitch, and then we'd move on to merging those humming sounds with vowels, so ma, and then producing words, producing phrases and into conversation. So working through a hierarchy of steps with pitch. The next thing we might look at is resonance. So again, in order to produce what's perceived as a more feminine sound, we would work on moving the voice from being placed at the back of the mouth to producing a brighter, cleaner sound where the voice is produced more from the front of the mouth. We might also work on introducing a slight breathy quality to the voice, again, something that's perceived as being more feminine, but it's really important not to over-feminize the voice. And then the third aspect of therapy that we might look at is intonation. So increasing the intonation patterns, increasing the amount of modulation in that person's voice, again, to allow that person to express emotion and to express feelings using their slightly new voice.
I suppose I was convinced my voice had changed gender when people stopped saying sir to me in shops or on the telephone. And I've had discussions with my friends about this and how everybody learned to do things differently. I had one friend who, whenever I rang her up, I'd say, what, have you just rushed up the stairs? Because she'd always go, hello, who's that? And then I'd say, it's me, and she'd go, oh, fine, okay, you know. And it was her way of being able to speak on the breath. So that when she picked up the telephone, nobody was going to call her sir.
The way I feel about my voice at the moment and the relationship I've got with it is not, I would not say I feel it's part of me as much now as it was before, because it's like someone's took control of my voice. Like I feel more alienated from it. It's like little man's inside my throat doing things, because I could be talking, if I'm quite calm and talking, it's quite level. Whereas I get a bit excited, it'll suddenly squeak. And it's very, very bizarre, because I don't know sometimes from one day to the next what it's going to do. But I'm really, really hoping that in the next couple of years, it's been 3 years, I'm hoping, it's going to have levelled off and not keep cracking when I get excited and when I show more emotion, that it's not going to suddenly squeak. And then people question me, why is your voice doing that? Because I have had people look at me who don't know, that I'm transgender, as to why does your voice keep squeaking? It's a hard thing to explain to someone.
So when we think about a perceived male voice and a perceived female voice, what is it we mean? The research suggests that the male voice is around 40 hertz lower on average in terms of pitch than the female voice. However, in reality, what we have is a whole spectrum of pitches in between those 2 points across which men's and women's voices are spread. In fact, voice is just one indicator of gender. In terms of our communication, other indicators are our body language, our presentation, our posture, our facial expressions. So voice is one element that creates a perception of gender, but it's one of many elements that creates that perception of gender.